Hey everyone, Wausau Mayor Katie Rosenberg here with my amazing compatriot, Marathon County Health Officer Laura Scudiere. How are you?
Hi, Mayor Rosenberg. I'm happy to be here, ready to talk more about COVID.
Oh my gosh, I'm sure everyone is excited. And I do mean that sarcastically. However, we're going to start this one off with what is going on TikTok, since that is our thing where we're checking for trends. So let's just start right off. My first question, people are nebulizing hydrogen peroxide to get rid of COVID on TikTok. And I know you probably shouldn't get medical advice from TikTok. So maybe we can talk about this one. This is it's a trend. I just want to make sure we're given the right information. So should we or should we not do this?
So, we can't give out medical advice. Medical advice should be given out by your doctor or your provider. So, I think if you think you have COVID-19, the best thing to do is to get tested.
Yes.
That being said, nebulizing hydrogen peroxide over the counter is not a treatment that is currently FDA approved and actually could be harmful. So, if you think about why you nebulize something, you're trying to get, when you nebulize something, you try to get chemicals into like these deep places in your lungs and these very sensitive areas. And so anytime you put anything in that route, it really should be in collaboration with a doctor, probably.
Right. So last time I had something that I nebulized, I was actually at the doctor's office last year, and they tell you exactly what you're supposed to be doing and they monitor what you're doing. So okay, good advice. Talk to your doctor. Don't take medical advice from TikTok.
Yeah, I love TikTok because I think my whole TikTok now is people pretending to be talking for animals. Like that's my that's my algorithm mostly now. So,
but it goes to tell you that you should, you've got content from all over the place, and the expertise might be entertainment as opposed to anything else.
Right.
Cool. Okay. Next question. Question we're seeing a lot from, can people who are vaccinated still get Delta?
Yes. So yeah, I get this question frequently because it's out there and people who are vaccinated can still get Delta. I know it's a variant of COVID-19. It is the predominant variant going around right now. Like it's pretty much all Delta in Marathon County. Okay. So I'm vaccinated. I could still get it. Katie, you've been vaccinated. So
I don't want it.
Yeah, so we want to continue to, if you really want to protect yourself, continue to wear masks, this physical distancing, good hand hygiene, all the stuff that protected us like before we had the vaccine should help protect us going forward. Again, the best way to protect yourself from COVID-19, whether it's Delta or otherwise, is to get vaccinated. And Katie, actually, I want to share a little piece of data that we've got here.
Show us the data.
So this is a graph about Marathon County. And you can see like the difference between the people who are fully vaccinated that get COVID-19 and how few people for all the people that were vaccinated per 100,000 people. There were 351.3 cases, 17.8 hospitalization, and 3.2 deaths. Now that's in comparison to this not fully vaccinated column. I just want to show you. I'm scrolling.
Yeah.
So there's a stark difference, right?
Yeah.
And you're much more likely to be hospitalized or die from COVID-19 if you're not vaccinated at this point.
Okay. So get vaccinated. You might still be at risk, just like with any other illness, I suppose. But it's still really important. You'll prevent yourself from hopefully getting super sick and having to go to the hospital or worse. So, okay. Thank you for that. That's scary data, but I'm glad to see it.
Well, it does. It proves to us that, getting vaccinated right now is a healthy decision.
Okay, good. So my last question, I don't know if you have an answer to this, if it's more of a political or policy type move, but questions about whether or not places where folks are working are going to mandate vaccines. I suppose you're getting questions about that. And is it allowed? And should we do that? Maybe you're having people seek advice. What do you know?
So it's a kind of an interesting question, Katie. And actually, you might be able to to be the expert on the policy side here,
Boy.
but so buckle up. But really, with vaccine mandates, there are federal mandates coming through OSHA. We're not sure what that's going to exactly look like yet.
Right.
And so we're kind of waiting to see what that looks like. I know some hospital systems and nursing homes have been mandating vaccines. Mandates, those kinds of mandates sometimes are organization-wide, sometimes they're policy-driven. It's not necessarily something that the local health department is enforcing. Instead, it's through their organizations.
Yeah, so I guess when it comes to policy, we still have, we have our insurance company, we have our lawyers, we have our HR department, everyone's kind of looking into it. And, the Biden kind of requirement, we're exempted from those OSHA requirements. So we're still talking through what that looks like and what that means. Obviously, everyone's pretty, everyone's got an opinion, and you want to do what's right for your organization to keep people healthy. You hope that people make their decisions based on science and they come to the right conclusions, I suppose. And I know we were talking a little bit earlier, but basically, like when you look at the evidence, the mandates work, and you're probably seeing fewer infections and spread.
Mm-hmm. Yeah, there's a lot of different things that do work when it comes to vaccination and trying to encourage vaccination. And we're doing a lot of the other ones, including like outreach and specifically targeting and trying to get targeting information specifically to disproportionately affected populations. So, and we're really focusing on Western Marathon County, where we have more rural populations and individuals that maybe English is not their first language, and those are important people for us to reach.
Right, making sure everybody has access. I mean, I think that's Health Department 101. Even before the pandemic, I remember you and I talking about this stuff. So super important. Thank you for being, that first contact sometimes for, county and local government. Wow.
Yeah, it's my job.
Well, thank you. I have a million more questions now after this, but we call this 3 things, not a million things. So thank you so much for answering them all. We'll keep monitoring TikTok for more bad medical advice.
Sounds great. I'm on it.
Okay, thank you. Talk to you later.